Newshub can reveal 80% of New Zealanders aren't confident their elderly loved ones will get the care they need.
The sector estimates it's 1,000 nurses short, and last year more than 1,200 aged care beds were closed. Here's political reporter Amelia Wade with this exclusive story.
Aged care nurse manager Natalie Seymour isn't just tired.
I would say I've probably been 3 shades of burnt out.
Natalie says she's also tired of the government not listening. Her centre is down 3 full-time nurses. That burden falls on everyone.
We have families who are not getting the level of service or care that they deserve because we just don't have the staff to do it.
It's not just the sector that's worried. A poll commissioned by Aged Care Matters provided exclusively to Newshub found only 22% of New Zealanders are confident their loved ones will receive the care that they deserve in the future. And 65% are concerned about aged care sector funding and workforce shortages.
This is not a problem that's going away. We have a crisis in New Zealand about aged care.
Do you accept that the aged care sector is in crisis?
It's certainly an area where it's challenging.
The government last year made a $200 million pay equity offer to aged care nurses.
It's about half the amount that they promised last year, and quite frankly, it's a drop in the bucket.
We have to make sure that money we're putting in to increase salaries actually goes into increasing salaries.
Aged care is far from the only corner of our health system desperate for staff. But Newshub can reveal the Health Minister doesn't know the true extent of the problem. Late last year, her predecessor was asked for a breakdown of the vacancies in emergency departments. He provided it. But this year, Aisha Verrill was asked for the exact same thing, but she said that the data wasn't held centrally.
In a statement, the minister said she recognised the information was of interest to the public and said that she'd asked Te Whatu Ora to develop a mechanism for it to be centralised.
Wasn't that supposed to be one of the things that Health New Zealand was created for, to centralise information and centralise data so we could report centrally? Clearly a failure of the health reforms.
Happy to look at that. I haven't got a briefing on that.
The Prime Minister likely someone else wanting to see better data. Amelia Wade, Newshub.